Mr. Chairman, thank you so much for your commendation. I really appreciate it, and I really appreciate your calling a hearing on this urgent issue. Welcome all of our distinguished panel. Congressman Kennedy, great to have you here. I appreciate your testimony as well as hearing from all of you, especially from the Department of Health and Human Services, about what additional actions we need to take to stem this epidemic. I do want to note I am once again disappointed that the directors of the Centers for Disease Control, Brenda Fitzgerald, was unable today to join us to give her perspective. But since this is an Appropriations Committee, I'll be pressing our witnesses to talk specifically about funding needs. Every day from every corner of our country, we hear more about the devastation being caused by the opioid crisis, from doctors who are treating babies born addicted to opioids, to parents who've lost children to an overdose, to veterans in chronic pain who are struggling with addiction, and the list goes on. In my home state of Washington, nearly 10,000 people have died of an opioid overdose since 2000. That is 10,000 lives that were cut short, with countless more families and friends who are left suffering and picking up the pieces. And I know these heartbreaking numbers are reflective of what is going on in states across our country. Because this epidemic doesn't discriminate, it can reach anyone and anywhere. So the opioid epidemic is a public health crisis as well as an emergency. And I personally am disappointed the administration has not taken decisive action to address it. What's needed to make a real difference in the lives of countless patients and families in my state and across the country struggling from addiction are real, immediate resources to fight this battle on the ground. And despite the work of the Commission and its recommendations, the Commission failed to identify any additional funding to battle this epidemic. Make no mistake, this epidemic is an emergency. Every day, 175 Americans die from opioid overdose. Yet the administration has been shockingly silent when it comes to identifying the resources to address this public health crisis of addiction here at home. And just to underscore how inadequate this administration's response to this has been, last month the White House's own Council of Economic Advisors released a report estimating the economic costs of the opioid crisis to be at over $500 billion just for 2015. That is 6 times larger than the most recently estimated economic cost of this opioid epidemic. And this cost is growing more each and every day, and it won't be addressed by stunts like the president committing to donating his third quarter salary to HHS. It's long past time for this administration to get serious about this crisis. Now, given the current budget caps, this subcommittee simply has not been able to provide the level of funding needed to make real progress in preventing and treating opioid addiction. Funding in the LHS appropriations bills has remained basically level, but the epidemic has not remained level. It has escalated. Overdose rates continue to soar. The epidemic is now being driven by synthetic drugs like fentanyl that are up to 50 to 100 times more powerful than morphine. And the most recent data suggests that more people are skipping prescription painkillers altogether, going straight to heroin as their first opioid. Given the scope of this crisis, emergency supplemental funding is desperately needed that will give our states and the communities evidence-based tools to turn this epidemic around. The current situation is unacceptable, and we need more than tough talk from President Trump to address this. Congress and patients and families need this administration to be an equal partner in fighting this epidemic, and unfortunately, we have not seen that yet. So, Mr. Chairman, I appreciate that. I do just have a few questions I want to ask before I have to return to my other hearing, and again, appreciate the commendation. Dr. Oury, I want to talk with you. I'm very concerned with this administration's lack of seriousness in response to this crisis, and I must say I'm worried about the potential impact that has on the work you all do at CDC. For one, I have to say I am, as I said, troubled to learn that CDS's new director and your boss, Brenda Fitzgerald, could be left unable to engage on issues related to the opioid epidemic due to her potential conflicts of interest. More than ever, we need CDC to be at the forefront, leading to combat this epidemic, and it has to start at the top. Now, I do want to ask more about CDC's current prevention strategies and what you're doing. Up until now, CDC's prevention efforts have focused on reducing the prescribing of legal opioids and improving prescription drug monitoring programs. Those efforts are undoubtedly worthwhile, but I understand that illicit drugs like fentanyl and heroin are increasingly driving the drug overdose. So I wanted to ask you, how are CDC's overdose prevention activities changing to reflect those trends?